Hello, this is Dr. Bhojraj from VR Spine, and I'm here to speak to you about a very important condition which is called cervical myelopathy. Now, what is cervical myelopathy? To understand cervical myelopathy, you need to understand a little bit about the cervical spine, which is the neck, and the other common condition called as cervical spondylosis. So, let's have a look at the spine model. So this is the spine, that's the pelvis or the hips. This is the head. So this is the part of the neck which is called cervical spine. This is of course the thoracic spine or the upper back, and this is the lower back which is the lumbar spine. Now in between the bones of the cervical spine you have gaps, and in these gaps you have cushions or shock absorbers. They are called as the discs, and they give the strength to the neck. They also allow for flexibility of the neck. So the spine has two functions: strength as well as flexibility. What is very important is behind the bones of the spine is a space through which the nerves travel down. So these yellow structures, as you can see, are the nerves, and the big yellow structure which is going down is the spinal cord, which is the main sort of wiring between the brain and the hands and the legs. And at each level there is a space in between the bones of the neck through which these yellow structures or the wires or the nerves are coming out, and they are going on left and right on both sides to the arms. So cervical spondylosis means aging of the spine. That means the disc starts aging, just as the hair can get uh, white. Similarly, the disc also loses its shock absorption capacity, and the disc can flatten out, and both the bones could come closer to each other. As you can see here, the bones are coming closer to each other, the disc is getting flattened out, and when that happens, the space available for the nerves to come out becomes compromised. Also, the spinal cord, which is the big structure, is also going to get compressed when the bones come closer to each other. If the disc is not working, then there will be pain in the neck, and the small joints in the cervical spine can also get arthritic. And this commonly happens in people who are on two wheelers, who run, who do activities such as running, skipping, jogging on a regular basis on hard surface, or in people who are in offices who are all the time looking down and working when there is a strain on the muscles and the spine. It's also found to be common in diamond assorters, diamond industry workers who are all the time sorting out diamonds, would have a strain of the neck. So this is called as cervical spondylosis, which is just an aging, and all it needs is a bit of exercise, a posture correction, a bit of medication, and modifications at workplace, adjusting the monitor height so that you're not working on the laptop on the keyboard like this, but looking straight. So these are simple things. So cervical spondylosis is not a disease, it's a very simple condition which happens in almost everyone, and it needs to be prevented and corrected. Now that you have understood about cervical spondylosis, now we are coming to an important condition which is called cervical myelopathy, which means in advanced cases of cervical spondylosis, if not attended to, you could have complications, because as I told you, the cervical spine has important structures coming out from it, such as the nerves and also the spinal cord which is going through it. So if the spondylosis progresses, as with advanced aging or not taking care of spondylosis in early stages, then the space between the bones is so much compressed that the small nerves as well as the major nerves could get compressed. And these nerves are connections between the brain and the arms and legs. So these nerves also control your urine, sexual activity and motions. So in cervical myelopathy, you could get severe compression of the nerves within the cervical spine. That is called myelopathy. And that could result in major disability, such as uh, tingling in the hands or legs, or numbness in the fingers, and gait disturbance like wobbly walking, or sometimes even loss of control over urine and toilet. So this is what myelopathy is. And as you can understand, it is completely at the other end of the spectrum of spondylosis, because in cervical myelopathy you have serious consequences. Now let's look at some pictures which will show us these uh, details. So this is an X-ray of the cervical spine, which is showing the head and the bones of the neck as I showed you in the model. Now you can see in between two bones, this is a normal disc with a proper height. If you follow my finger down, after the three discs, here you can see that the space available for the nerves has become less. So the space in between these two bones has reduced. So this disc is now compressed, as I showed you in the model. Similarly here, so in the lower part of the neck, there is spondylosis and wear and tear and shock absorption. So this could give rise to neck pain, and all you need is good exercises from this to progress further, and we want to stop this progress. So good exercise, medications, physiotherapy, and maybe in the initial stage, if it's very painful, cervical collar for some time. So this is the treatment for spondylosis. This is an MRI of a patient which is showing the extreme form of spondylosis, which is called myelopathy. So this is the brain, and this is the spinal cord, which is like a conducting wiring which is going down to the arms and legs. And you can see the spinal cord is covered with like an insulation, like white area, like the wire has a insulation of rubber. Similarly, if you follow my finger till here, everything is okay, but here the spinal cord is very badly compressed, and there is no, so everything, the conduction of the electrical activity from the brain will be blocked in this much area, and everything below this will be blocked. As you can also see here, the disc also has come out. So this is what is called as cervical myelopathy. Now let's look at treatment options. So there are two groups. One is cervical spondylosis, which I've already spoken about the treatment. It is not something which is dangerous or worrisome. But now coming to cervical myelopathy, once diagnosed, it is very important that we treat it early enough before the patient starts developing complications. And that early thing is surgery, of course. In cervical myelopathy, once it is proved by examination, by investigations, by MRI, and the patient has come to you with difficulties, then early surgery is the treatment. And in surgery, what we do is we release the nerve and we make more room for the spinal cord so that these patients can recover from the conduction block. And over a period of time, the conduction starts and the patients would get better. So in patients with cervical myelopathy, the red flags would be neck pain, which is not getting better like in spondylosis, it's just getting worse. More than pain, they will have tingling, numbness in the hands, slowly weakness of the hands, difficulty in buttoning, difficulty in signatures, difficulty in eating by hands, fine dysfunction of the fingers. Also, because the bigger nerve is also blocked, they would get problems in the legs such as tightness or difficulty in walking, wobbly gait, unsteady gait. So if you have these red flags, it is important that you meet a spine consultant at the earliest and let him plan the best treatment for you. So to summarize, the neck problems could be very minor, such as neck sprains, for which you need only bit of medication. Then spondylosis, which needs a proper advice, as I have mentioned. And the extreme step is the cervical myelopathy, which needs nothing less than early surgery to solve the problem. Thank you.